Can you believe it? We're to lecture number 7, where we talk about tumor immunology and transplants. It's our last lecture, so stay tuned for something very, very exciting. We need to start with a few terms related to oncoimmunology, and that's basically when cells form abnormal masses. That's called oncoimmunology. Neoplasm is an accumulation of cells derived from a single cell, also known as a tumor. Oncology is the study and treatment of tumors. A cyst is an abnormal collection of fluid within a sac or wall. A tumor is new and unusual growth of a tissue. Carcinogen is a substance known to cause cancer. It could be chemicals, viruses, things like that. Benign means no spreading surrounded by a capsule. Malignant means there's uncontrollable growth that returns after removal and it's not encapsulated. The tumor is then invasive. And cancer is malignant growth of tissue with a tendency to metastasize. A primary tumor is the tumor in its original site of origin. A secondary tumor is a tumor that spreads from the primary tumor. A sarcoma is cancer of the non-epithelial connective tissue. Some examples, we have osteosarcoma, which is bone cancer, and neurogenic sarcoma, which is nerve fiber cancer. Carcinoma is cancer of the epithelial tissue or skin cancer. Leukemia is cancer of the hematopoietic cells or hematopoietic tissues. And lymphoma is lymphocyte malignancies or their precursor cells. Lung cancer, colorectal cancer, and breast cancer are the leading causes of cancer deaths in the U.S. Cancer is more likely to occur in men than in women. And cancer is the second leading cause of death among children from the ages of 1 to 14 years old. Do you know what kind of cancer that is? That's right, it would be acute lymphoblastic leukemia. There is a number of factors that could contribute to the risk of cancer, and that would include chemical-induced tumors or environmental things such as asbestos, lead, tobacco, radiation. You can have viral-induced tumors that stem from human papillomavirus, HIV, or the Epstein-Barr virus. You can have ultraviolet light exposure that contributes to a person getting cancer. You can have spontaneous tumors that just kind of appear out of nowhere. You can have a genetic predisposition to cancer. Let's say you have a genetic chromosome abnormality. And certain drugs can increase your risk of cancer. Drugs like steroids and estrogen. There's a number of ways that your body defends itself from cancer. The T cells, specifically the cytolytic T cells, may lyse the tumor. The natural killer cells are involved in the immunosurveillance of developing tumors. The natural killer cells watch out for potential tumor cells. The macrophage produces the cytokine tissue necrosis factor, which kills tumors by direct toxic effects. And then finally, we have antibodies that can be produced against tumor antigens. You've heard of the phases of cancer where somebody says, I have phase 2 cancer or phase 3 cancer. The induction phase of cancer is known as stage 1 cancer, where the normal cell has its DNA damaged. It's been exposed to a carcinogen of some sort. Stage 2 cancer is the in situ stage, where cells have transformed into cancer. It is localized and not spreading at this point. Stage 3 cancer is invasive phase, where cancer begins to spread to the surrounding tissues, vessels, and lymphatic channels. And then stage 4 cancer is the dissemination phase, where the cancer starts to metastasize and has completely metastasized. Tumor markers are biochemical substances associated with tumors that are used to guide the course of cancer therapies. They're released into circulation in blood and body fluids. These biochemical substances could be proteins, enzymes, hormones, oncofetal antigens, glycoproteins, or cytokines. The nature of tumor markers are that they are normal cells that are transformed into malignant cells, develop unique antigens not previously present on the mature normal cell. Tumors have integral and surface antigens. Some surface antigens can incite protective immunity, but usually tumor markers are used to screen and monitor cases of cancer. Some specific tumor markers that we're going to talk about today would be alpha-fetoprotein, carcinoembryonic antigen, CA125, beta subunit of HCG, CA19-9, and prostate-specific antigen. So the carcinofetal antigens or oncofetal antigens are normally expressed in the developing fetus but are absent in normal adult tissues. It is a type of tumor-specific antigen. A fetal gene product secreted that normally is not secreted in adult life. One such example is alpha-fetoprotein, and another example would be carcinoembryonic antigen. Alpha-fetoprotein is found in fetal serum but not in adult serum unless cancer is present. In primary hepatomas, a metabolic shift of liver tissue occurs, making the tissue revert back to a fetal-like state, so alpha-fetoprotein is produced. Alpha-fetoprotein is normally synthesized by the fetal liver and yolk sac. It is elevated in cases of liver cancer and can be elevated in non-cancer conditions also. It's a reliable marker for monitoring chemotherapy and radiation treatments. Carcinoembryonic antigen is also known as CEA. It is normally found in normal fetal endocrine tissues in the second trimester of pregnancy. It is elevated in the colon, lung, breast, pancreas, and liver cancers, and it's used to monitor tumors. CEA is normally elevated 2 to 3 months before the symptoms of cancer ever appears. CEA is not a good marker for screening if someone has cancer, as it can be normally elevated in the elderly and in people that smoke. The beta subunit of HCG is a sensitive tumor marker. It is elevated in sinus tumors, oat cell carcinomas of the lung. The new name for oat cell carcinoma is small cell lung cancer of the bronchioles. Carbohydrate antigen 125 and carbohydrate antigen 19.9. Carbohydrate antigen 125 is elevated in ovarian cancer. It's elevated also in pelvic inflammatory disease and endometriosis, but it's most useful in the diagnosis of ovarian cancer or ovarian carcinoma. CA19-9 is elevated in pancreatic cancer, elevated in gastrointestinal cancers, and is elevated in breast cancer, but it's more specific for pancreatic cancers than CEA. Prostate-specific antigen is an organ-specific antigen for the prostate, but not tumor-specific. It's present in the cytoplasm of both benign and malignant epithelial cells of the prostate. Prostatic acid phosphatase is not organ-specific, but it can be elevated in prostate cancer. It's elevated in prostate cancer, but can also be found normally in the liver, brain, lung tissue, heart, and spleen tissue. Prostate cancer is a leading cause of death in the U.S. Prostate-specific antigen and prostatic acid phosphatase are tumor markers for cancer. There's a number of ways the laboratory can detect tumor markers. We can use ELISA or EIA. Radioimmunoassay looks for an antibody linked up with an antigen and radioactive isotope. Indirect fluorescent antibody. Polymerase chain reaction. Western blot. And fluorescence in situ hybridization, which is a molecular technique that uses fluorescent probes and DNA to diagnose cancers. There's a number of different treatments for human cancer. One is called adjuvant therapy. That's the addition of a substance to enhance immune response. For example, the BCG vaccine is an attenuated strain of Mycobacterium tuberculosis. It's used to help treat skin cancers because it activates macrophages. Immunotoxins are antibodies and toxins that are combined to target cancer cells. Lymphokine-activated killer cells can be transfused. Chemotherapy, radiation, and bone marrow transplants, where the donor must be a genetically identical twin or someone who is antigenically similar and who has not undergone radiation treatments. Let's start to talk about transplantation. But first there's going to be some terms. So an autograft is when tissue is transplanted within the same individual. So an example of that would be a tendon graft. A syngraft is when tissue is transplanted between two genetically identical people. So that would be bone marrow transplants. An allograft is when tissue is transplanted between two non-identical people of the same species. For example, kidneys, heart, and lungs. A xenograft is when tissue is transplanted between individuals of different species, such as a baboon's heart that has gone into a human baby, or pig heart valves into a human. And a hemostatic graft is when grafted tissue serves as a structural support or through which host tissue grows to reestablish the original structure. So for example, a hemostatic graft could be a rib bone that is there to structurally support other grafts. The major histocompatibility complex are potent antigens that provoke an immune response. They are a complex of tightly clustered genes located on chromosome number 6. All mammals have a chromosome that encodes major tissue antigens. Major histocompatibility complex encodes the HLA antigens, which are the molecular basis for T-cell discrimination of self from non-self. MHCs are the most important antigens that trigger immune response, second only to the ABO antigens. These antigens are important in influencing the genetic basis of survival or rejection of transplanted organs. The role of class 1 and class 2 HLA antigens. To bind peptides within cells and transport them to the plasma membrane where they can be recognized by T cells. Class 1 are the watchdogs for viral, tumor, or parasites that may be present in a cell, while Class 2 alert the CD4 T cells that foreign proteins from outside of a cell are present. The Class 1 antigens are expressed on all nucleated cells and regulate the immune response by acting as targets for T cells. The Class 2 antigens are expressed on B cells, activated T cells, monocytes, and macrophages. They're involved in the presentation of antigens by macrophages to T helper cells. There are many different types of transplants, including the most common organ transplanted, which is the kidney. Heart valves, usually pig or cow heart valves that go into a human. Heart transplants. HLA is usually not performed due to the lack of time because a heart must be transplanted within 4 hours. Cornea transplants first took place in 1944. Skin transplants, they're commonly performed, but they have a very high rejection rate. In lung transplants, the recipients have to have an identical bronchial circumference for lung transplants to be successful. Then we have pancreas transplants, bone transplants, stem cell transplants, and liver transplants. 50% of livers that are transplanted do develop biliary leaks. Now face transplants and whole head transplants may occur as a collaborative effort between China and Italy. When immunocompetent T cells are transfused from a donor to an immunodeficient recipient, one could develop graft versus host disease. T cells injected into the host recognize the host as being foreign and can actually reject the human. This sometimes happens when families give blood via direct donation. The transfused T cells recognize the host antigens are foreign and react immunologically against them. Instead of the host rejecting the grafted tissue reacts immunologically to the host tissue, causing inflammatory response. Graft versus host disease can cause an uncontrollable type of cellular destruction that may lead to the death of the host. Graft versus host disease can be eliminated by irradiating blood products. Before a transplant should occur, the goal is to avoid graft rejection or graft versus host disease. So we have to identify the donor and recipient HLA and ABO antigens. We have to identify antibodies from previous sensitizations in the recipient, and we should do mixed lymphocyte cultures. All right, so those are the tests that we would do prior to having an organ or tissue transplanted. And that brings us to the end of Lecture 7, and that is all.